Bet it was beautiful.
Yeah, it was pretty for the first snow of the year, but it gets old. It's the beginning of the winter. Half the trees are still yellow and red. So yeah, it's cold, but it's Colorado, right? So yeah, I guess it was pretty. Yeah, it was pretty. Hi, Kindle. Good afternoon. Hi, Kindle. Hi, Kiana. Hi, Kiesia. Is that how you say your name? How do you say
Yes, how
your
you doing?
Kiesia?
Kiesha.
Kiesia. Okay.
Yeah,
How are you?
good.
Well, you're all settling in. If you could just please put your name and your campus in the chats for my attendance, if that would be great. I appreciate it. Hi, Constance. How are you?
I'm okay.
Hey, Kindle.
Hey, how are you today?
It's Friday.
I know.
Although all these days just seem to go, Friday just seems to be another day. It's not really a weekend yet. Hi, Blake. Hi, Marissa.
How you doing?
I'm okay for a Friday. How about you?
Can't complain.
Good. Dikshaya, hi. Is that how you pronounce your name? Okay, sounds good.
It's Diksha.
Diksha, okay. Feel better.
Thank you,
Hi.
Professor. Thank you.
Hi, Erica.
Hello.
How are you?
I'm good.
Hi, Chantel. Oh, Chantel, you're sitting outside. Must be nice. I'm sitting here looking at snow.
Yes, ma'am. Oh, really?
I'm looking at snow. Yes.
I think I would rather it versus the heat, though.
I don't know. I'm getting too old. The cold, the winters. It's hard for me to get through the winters. I'm too old for the cold weather. I prefer heat,
I understand.
24/7. Hi, Jasmine.
Hello,
How are you?
I'm good.
Good. Hi, Tawanda.
Hey,
Hey, hey, how are you?
I'm okay. What about you?
I'm hanging in there for a Friday.
Good.
Everybody, make sure you put your name and your campus in the chat. That'd be great. I had to send a nasty gram to my neighbor a few minutes ago because all her dogs do are bark. They bark and they bark and they bark. Does anybody have a solution for barking dogs of neighbors? I don't get it. I'm just venting for a Friday. I don't get it. How can you leave your dog out and bark for hours at a time? Anybody have any? It was a nice message. It just said, I can't teach with your dog barking in my ear. Anybody have any other solutions?
Hope they got the message.
She did. The dog's in. Well, I mean, come on. I mean, I don't have dogs now, but I've had dogs my whole life up until a few years ago. But if my dog sat out in the back and barked for hours on end, wouldn't you kind of think of like, what are the neighbors thinking? Or think this might be a little distracting to other people? I don't know. That's my Friday vent. But really, come on. Come on. Okay. Okay, I need everybody's cameras on, please. So the good news is this is week 5. We're almost done with week 5. And a week from now, it's going to be the end of week 6, which means we're halfway done. Where does the time go? So how are all you, just doing a check-in? How are you? I know you guys are all busy. You're probably exhausted trying to juggle everything. How's everybody doing? You guys have put your time management skills into high gear this term? Organizational skills, time management skills. Have you put that into high gear? Because you need it, right?
Exactly. Very hard.
Very hard. Yes. Yes. I consider you guys my resilient group. You're all full of resilience. Otherwise, you wouldn't be at this point right now. So you're making it work. You're figuring it out. And for that, I'm proud of you.
Thank you.
Very proud of you guys. I know you have a lot going on. Okay, today we're going to cover 4 different topics. We'll cover the readings, but I want to go over a couple of things first. We'll do the content first. Okay, we'll do the content first, and then we'll do quiz 3 together. So don't do the quiz yet. If you've already done the quiz and you didn't get a 10, after we go through the quiz here together, if you want to resubmit me your answers on a Word document, because I can't reset the quiz. I don't know why I can't, but I can't. I'm going to ask for that to be done next term. We're going to take a look at the HESI prep assignment, because I don't want you guys getting behind on that. Okay. Exam reviews. I've only heard from a few people. And I want you to know that I'm happy to review the exam 1 with anybody. Okay. I mean, if you got below a 78, I really, really want to review the exam with you, see where we fell short. talk about some strategies, test taking strategies. And if you got higher than a 78, I still would be happy to review the exam with you. I have students that get in the 80s and 90s that want to see the questions they got wrong. So please reach out to me if you want to review the exam. Okay, it's a good exercise. Okay. Study guide for the next exam. I've been trying to work on this week. It just needs a little bit more tweaking. And so I hope to have that to you by tonight. Okay, so you'll have it tonight, which will be a week ahead of time, because you'll be taking, no, it'll be 2 weeks. What do I have next week? My other RN classes take it next week. So you'll have 2 weeks. So give me till tonight or in the morning, but you'll have exam 2 study guide in the next 24 hours. Okay. And then you already have this, well, it's kind of a little early to talk about it, but you have all the exam reviews. I already sent those out to you early on. Okay. So there are 3 exam reviews for, I guess it would be next week, because next week will be 6. So in your planning for next week, okay, try and get to a review. Okay. I know I do mine next Friday. I think Dr. Kershaw does hers next Sunday. And I'm not sure when Dr. Ford does hers. She usually does hers early in the week. So make sure you go back and look at that schedule. Okay. And then try your best to attend a live review session. I know you're juggling lots of things. And if you can't attend a review session next week, at least listen to the recordings. I will provide you with all 3 recordings. Okay. Okay. Next week, you know what's due this week, right? What do you got due this week? What do you guys have due this week? Let's pull up the syllabus here. All we have this week, guys, is quiz 3. Okay, so we're going to do that today. Okay, so we're going to submit that today, and we're going to do our attestation today. So you're going to be done with community assignments. Okay, so we'll get those 2 done. But what I want to remind you of, and last term was the first term I taught PN students. And so I want to be mindful of reminding you that as we get to weeks 9 and 10, it gets pretty busy. Okay, so these next couple of weeks, for example, this week we just have the quiz. Next week, you just have a quiz, which we'll do during class again, and you have an NCLEX. Okay.
Trying to tell her, hold on. Miss Marvel?
Yeah.
The ones from Centerville, we're here trying to take the exam, but it's not available on the Examify right now.
Okay. Do you have? It should be. Okay. So are you not being proctored on campus?
Yeah, we're on campus. It's not available for down if we don't have it on our computers. Our proctor is here with us though. I need to.
All right. Okay. Everybody can just take a pause for a minute until I sort this out for a group of students who are taking their exam today. Sonia, where are you? Just stay on. Okay. Let me go to ExamSoft real quick and make sure. Let's see what's going on. Okay.
Okay.
All right. Hang tight.
You want to talk to her?
Oh, go ahead.
Oh, hi, Miss Marvel. This is Miss Connor.
Hi.
Was I supposed to set it up for them?
No, I thought it was all set up, and I sent you the code.
Oh, yeah, I got your email. I just
Okay.
thought maybe I was supposed to put in the, all the details.
No, that's all in there, but let me go back and double check, okay?
Oh, okay.
All right,
Thank
so
you
ha-
so much.
yeah,
I'm just
hang-
now getting in my computer
All right,
because I
let
just
me-
got out of a meeting.
Yeah, let me go back and check ExamSoft. Hang on 1 second.
Thank you so much.
You're welcome.
I just want to make a note.
Sonia, where'd you go? Where's Miss Connor?
I'm right here.
Hey, I just checked and it's all ready to go. And it looks like one student has already downloaded it, Emma.
Oh, okay.
Emma's already downloaded it, so the other students should be able to download it.
Here, let me.
Okay.
I'm sorry. Let me show you my computer real quick. This Emma was the only one able to. How do I turn the camera around? Can I turn the camera around? Emma was the only one able to download it, so we don't have it. Is it clear? No.
Okay, hang on 1 sec. I'm gonna move you to a breakout room.
Okay.
All right. And the rest of my class, sorry, you guys, there was a group of Centerville students that are taking the exam today. So this is what's going on. So you guys all just hang tight, please. Okay. And let me try and get this sorted out. Breakout rooms.
Usually we don't have an issue, but I'm trying to get it.
Okay. I need to assign Sonia.
You're on same. Yeah, we're in the same class, so it's not. I think Trey is the only one that's not in the same. They have different instructors.
Yeah, but majority of us all been the same with Mark.
Yeah. Hey, Sonia. Sonia, can you hear me? Where's Sonia? Sonia, can you join the breakout room, please? Okay. Still having the issue?
Yes.
All right, I'm gonna give Dean Brown a call. 1 second. And what is it saying? Show me what your screen is.
How do I turn this around? Right here. So it's saying right here, the one that we already did, that we had started that day, it's saying completed, but it's not another one for me to download.
Not the original one. You have a new one, the duplicate.
Right. It's not on there.
Nobody's showing up.
Isn't that duplicate? Oh, it says the duplicate's completed.
That was my 206. That wasn't 208.
Oh, okay. All right. So under download, what about,
We got is
is that,
204.
is that
That's
the,
204.
okay, that's 204.
That's for my
Okay.
key.
All right, 1 second. Hang on 1 second.
Maybe I need to log out and then log
I
in.
did. I done logged out and logged back in 2 times now.
Okay, 1 second. Just keep your screen. I want to see your screen because I want to be able to read it to
Okay.
Dean Brown. I'm going to mute you for a second.
Okay.
I mean, this 119, we supposed to start. It usually does. But I'm working. At 1. Our time is always 9:00.
But if it's Friday, then I'm
Last Friday was what? Was it 10:30?
10:28.
10:28. I have one here that says 10:31. I have one that says the second is the 19th.
And that's how you have to schedule it.
But the 28th is what we could,
Second option.
we started.
In her house.
She's out there,
Now, this computer, I'll be right back.
She goes snacks and drinks. Her chair and I can't see it.
I'll be right back. I need to go back to my class real quick.
Okay.
I'm waiting for Dean Brown to call me back.
Okay.
Sorry, ladies. I'm still trying to get this sorted out. I apologize. You know what you guys could do while I'm trying to sort this out? Could you guys please, as a group, pull up your HESI prep study guide? Okay? Please, because we're going to cover this anyway, or I was going to cover it with you. Section number 1. Hang on. 1. I think it's section 1. 1 second. So if you guys could pull up your HESI study guide, and I would like for you to talk with each other for a few minutes about all the topics on there that we've covered so far. Okay, so I want you to start filling this out. One of the things that I was going to mention to you is that the next 2 weeks are pretty light on community assignments. Okay, they're pretty light. But starting week 6, just in NCLEX and the quiz we're going to do in class. Week 7, you have your group project. Okay, so that's big. Okay, hang on. I just need to pass on this message from Dean Brown.
Is the group 7 project, is that pass or fail? It says pass or fail in this.
Yep. Yep.
Oh, okay.
Yep,
I was
it
just
is.
wondering. Thank you.
Okay. Would you guys start a discussion, please, about this HESI prep? Just help each other out. And then when I come back, we'll cover it.
Okay, Miss Marvel, we got it.
Everybody's hungry.
I think you're on mute. Yeah, are you on mute or am I on mute?
No, I'm on mute. She said, Dean Brown said to refresh.
Yeah, we got it. We got
You all
it. Thank
got
you.
it? Okay,
Mhm.
great. All right, thanks.
Thank you.
Okay, bye-bye. Okay, group. Sorry for that. Sorry for that. Okay, so what I was going to tell you, first of all, everybody needs to turn on the cameras. Okay. Okay. So what I was going to tell you guys is week 7, you have your group project. Okay, week 7, 8, and 9 get super busy. So that's why I'm trying to get you to get some of these assignments done ahead of time. Okay, so week 7 is your group project. So the sooner you get that done, the better. Get your group going, get working on it, and get it turned in. Don't wait till week 7. Okay, if you'd like. And then week 8, you have a quiz. Okay, so week 8 is a good time to also work on. Week 9, you have your HESI prep, and then week 10, you have your vulnerable populations assignment. So I highly suggest that weeks 9 and 10, you have 2 big projects due. And 7, you have your group. Get working on those projects, please. Otherwise, you're going to end up extremely overwhelmed, because in week 10, you have your exam, your 3rd exam as well, and then you jump right into your HESI in week 11. Okay, so that's busy. So week 7, group project. Week 9, you have your HESI prep and your exam 3 review. Week 10, you have your exam plus your vulnerable populations assignment. And week 11 is HESI. That's a lot in 3 weeks. So take these next couple of weeks where the assignments are pretty light and get working on these assignments. Otherwise, come week 9, it's going to be extremely overwhelming. Does that make sense? Get working on these, seriously. And that's why, let's pull up the HESI prep. I'm going to start there. I know we have content to cover, but I'm going to share my screen and I'm going to pull up the HESI prep. Okay. Can you guys all see that? Share. There we go. Can you see that? Okay, what have we covered so far? Okay, we haven't covered this so far. We've covered this section. Health promotion and teaching. Okay, this whole section, you can complete this. And, I don't care. My last term, there were students on the same campuses worked in study groups. I mean, I'd like for everybody to complete it individually, but if you're working in groups and want to split it up, I'm okay with that. Okay, so this whole health promotion and teaching should be completed. Okay, and I may not have addressed every single topic because I can't get through everything. And so if you haven't gone onto your ebooks and done your readings, a lot of this information is covered in that. Okay, so you're going to have to do the legwork. Occupational health, we're going to cover next week. Environmental health, I believe we're going to cover next week. This week, today, we're covering all this. This whole home health section should be able to be completed. Okay, and really what I'm looking for is just a couple of sentences. What is hospice and palliative care? What's respite care? How do we do a home safety assessment? I just want to make sure you understand each of the topics. Okay, and I told you where this came from. I was able to look at, I don't know what the questions are on HESI, but I know what the topics are. And that's based on the remediation that was done last term from students. So there are questions about each of these topics. I don't know what the questions are, but I know the topics. So that's a big start. Okay. We've gone through infectious disease. That you can complete that section. Last week, we went through vulnerable populations. So this section can be complete. Go back to your notes. The notes you took and the notes I gave you, or that we give every week. All right. So that whole section should be able to be completed. So, at least over half of this, if not a little bit more than half, has all been covered for you. We'll get with the bioterrorism and disaster that comes up. Okay. We haven't done that yet, but we will get to that in the coming weeks. But a lot of this has already been covered. So I would highly suggest that you guys take the time to go through and complete this, because otherwise, if you don't, week 9, when this is due, it's going to be a huge, huge project for you. Okay. So again, if you want to work in groups, work in groups. I'm okay with that. If it makes it easier and less time consuming, but everybody has to turn it in. Okay. Any questions on that? If you haven't put your name and campus in the chat, please do. Okay, so your notes. I just want to, your notes, oops, gosh. Your notes for this week. Okay, I don't know if anybody's had a chance to review it, but I'm going to review the material in the book for the topics we're covering, which is hospice and palliative care, death and dying, faith and spirituality, and ethics. That's what we're covering this week. Okay, your notes are an excellent summary of the content. In fact, you can probably get a lot of information from your notes to complete your HESI prep. Okay. So I'm going to start with ethics. Okay, so in ethics, you were asked to just read a couple of pages in your fundamentals book, chapter 3, pages 44 through 46. Okay, so let me go into the book and cover what I've highlighted, and then we'll come back and see what else we need to know in our notes. Okay, why are ethics important in nursing? What are ethics? What are ethics of patient care? What does that mean? We deal
It's
with
how we do things. It's rules of conduct.
Absolutely. Excellent, Kendall. Yep. What else? Why are ethics so important for in directing our care? Okay, we have the principles of ethics, you know, do no harm, do good, do no harm. Right? We have to be performing within our scope of practice. And in nursing, we have a code of ethics that we are expected to perform our best practices for what we know for the current situation. Okay, so let's jump to the book and let's cover a few things with ethics. Okay, I'm on page, no, I'm not. I need to get back to chapter 3. So we're going to do chapter 3 first. Legal and ethical aspects of nursing. Okay, we're going to jump to page 44. I don't know if you guys know how to do this, but once you get into the book, if you know the page numbers that you need, you can just put the page numbers right down here in the corner, hit enter, and that page will come up. Super easy. Okay. So here's what we're covering. Page 44, ethics in nursing. Okay. So as Kendall said, these are rules of conduct, right? We have all agreed upon the code of ethics, right? What is morally right or proper, right? What are the expectations? What are the behavioral expectations for our profession? All right. And we know that ethics is very closely linked to values. Okay. What's an ethical dilemma? Right? Simply when two people are holding different values. Okay, code of ethics, by us living by our nursing code of ethics, the attempt is to provide our code of ethics as a framework for providing for us to be making professional decisions. I mean, think about all the different kinds of ethical issues that come up, whether it's end-of-life care, abortion, violence. I mean, cultural competence. I mean, we are involved in ethical decisions every day, right? So what is our code of ethics? Okay. And this is from the ANA. These 3 bullets I want you to know, okay? It is a respect for human dignity and the individual. They're right here on page 46. Okay? A respect for every individual, irregardless of religion, lifestyle, culture. Right? It's a commitment on our part as nurses, right? To always seek out continuing education, evidence-based practice, to maintain our competence, right? To always be trying to improve our practice. And then the code of ethics also really focuses on the confidentiality of a nurse-patient relationship. Really important in nursing ethics is confidentiality. Okay, and ethical dilemmas. Okay, we're going to face many of them. One of the most common at this currently revolves life and death decisions. Right? How do you view end of life care? So here's some ethical terms that we need to be familiar with. And remember, we're only covering a couple of pages in this chapter. So these are some words we need to be familiar with. Beneficence. You've all heard of the beneficence, non-malfeasance. Well, beneficence is the fancy word for do good, right? Ethically, we should be trying to do good to help others. That should be our standard practice. And I would even say outside the workplace in life, right? Do good. Take positive actions to help others. Non-malfeasance, okay? To avoid causing harm. Okay, these are ethical principles. So do good, do not cause harm. Veracity, being honest and truthful. And then fidelity, keeping our promises. So these are common ethical terms. Okay, autonomy is synonymous with self-determination. And self-determination means we want to help our patients, clients self-determine what their plan of care is. We want to give them the autonomy, if they're able, to make those decisions. Okay, justice, treating people with fairness. And then privacy and confidentiality, respecting patients' privacy. Okay, this I want you to review on your own, but this next box is the Licensed Practical Vocational Nurse Code of Ethics. And if you're not familiar with this, you should be. Or, I don't mean to say that, you should be moving towards, as you're learning and going through nursing school, you should be learning and continuing to practice within the code of ethics of the LPN or the LVN. Okay. So really important information to review. Okay, and again, the next box as well. Okay, you have to know your limits. You have to operate within your scope of practice. Okay. So that's what I'm going to take out of these few pages, but I want to go back to our notes because that provides additional information about ethics that I want to review with you. Okay, so we're on chapter 3. So you need to understand about moral distress. What is moral distress? It's described to you in number 1. Okay. It's your, really what it means is you're unable to act in accordance with what you believe to be the right course of action. So end of life, right? Moral distress can be a burden for nurses at any given time. Lead to burnout, stress. I'm not reading all through this. I'm highlighting the important points, but you are responsible for knowing the notes. Okay. What are some examples of moral distress? End of life decisions. Maybe you're working in a hospital or someplace where your load is too high. Patient load is too high. You're stressed about the COVID-19 visitor restrictions, maybe patient having to die alone without their family, not enough ventilators. Okay. What is the decision-making process? This is important right here. Okay. What is the first step in ethical decision-making? It's to identify whatever issue is being faced. Because you can't go through the ADPI, you can't go through the nursing process until you've identified what the actual issue is. Okay. And then we have to decide how we're going to make what approach we're going to take. We have a couple of different models. We have the utilitarianism model, okay, or principalism. They're the same, okay. And these are ways we make a decision. So remember a utilitarianism. Okay, we do the action first and then evaluate the outcome. That's what utilitarianism. Whoops, trying to highlight this here. Okay, so that's utilitarianism. Okay, we need to understand what our ethical theories and our ethical principles are. Okay, utilitarianism is one of them. Autonomy is another one. The principle of autonomy, which is the right to self-determination, right? The principle of autonomy. Can we involve the patient, client as much as possible in making their own decisions? Okay, so this describes a little bit below are your ethical theories in more detail. So we have your principalism. Okay. Principalism includes your respect for autonomy and beneficence. And what do we remember beneficence is? Do good. Okay. So that's the first one. And I just need you to have a general understanding of what each of them are. Okay. Principalism. We look at respect for autonomy and beneficence. Okay. And then we have utilitarianism. Okay. This is focused on the outcome. Right? What's going to achieve the greatest amount of good or the least amount of harm? Right? So the example we give is, so locking people down during COVID was an attempt to slow the spread of the virus, right? Which adheres to this principle because the end justifies the means. Okay? So those are the two principles I want you to know. What happened in nursing homes during COVID? Patients were isolated, unable to see family, unable to visit with other residents. Okay. And then if you are unable to provide high quality nursing care due to whatever moral distress you might have or ethical dilemmas, You can't just walk off. You must arrange a replacement for you before you stop caring for the client. Okay. I had a student tell me a couple of terms ago that she worked in a prison. Okay. And one of the clients, one of the prisoners was in prison for murder. And the person he murdered was her relative. What kind of ethical and moral distress do you think that caused? I mean, think about that situation. How would you handle it? You know, I don't know how you feel about homeless people. I don't know how you feel about, you know, the teen pregnancy population. Are you morally capable of caring for those clients after you've checked your own values and beliefs? Or do you support end of life? How do you support end of life care? What does your end of life care values and beliefs look like? I just had a relative, Tom's relative, Tom's mom, my Tom. His mom was placed in hospice. She had been cared for in her home for, I don't know, 4 or 5 years with dementia. It was getting progressively worse. And they had a team of healthcare givers. There were 4 or 5 of them that rotated her care 24/7. Worked well. It worked well until she had a fall. And within a week of her having that fall, and she hadn't fallen in 4 years, within a week of that fall, she was in hospice, right? She broke her hip and she was 97 and she just deteriorated, I mean, overnight after she fell. She'd just been kind of cruising along with her, you know, developing dementia. It wasn't anything earth-shattering, but she fell and it was earth-shattering. And what happened was, once she went into hospice and you started to implement the hospice practice of end of life care, end of life comfort, and administering morphine for comfort, there were 3 out of the 5 caregivers that didn't agree with that. Morally, they felt like they were progressing her death. And they couldn't take care of her. They didn't want to take care of her. And the family had to respect their rights and, you know, had to make alternative arrangements. But I mean, that happened 6 weeks ago. And it was amazing to watch the process play out. And they were very caring, very respectful about their decisions, but it was about their moral beliefs of end of life care. Okay. We talked about code of ethics, advocacy, big, oh, sorry. I don't know why I just did that. Advocacy. What's advocacy? Our nurses, we are just known to be advocates, right? We advocate for our clients and our patients all the time, right? We advocate for what's in the client's best interest. That's all part of ethics, right? Advocating for clients, maintaining confidentiality, carrying out the wishes of the client. Okay. So that's our ethics. Anybody have any questions on that? And does anybody have any questions on ethics? Ethics is a huge part of life. It's a huge part of our personal life. It's a huge part of our work life. If we're nurses, it's an extremely important part of our profession. You are going to be faced with ethical issues and ethical dilemmas all the time as nurses. And so you really have to have a good understanding of ethics ethical principles, ethical foundations, code of ethics. Okay. Okay. Let's jump to chapter 14, which is cultural and spiritual aspects. Oops, I'm going to do that. All right, so how do we address the cultural and spiritual aspects of our patient care? Okay, and technically you're responsible for the whole chapter here. I've tried to break it down. You don't really need to read the chapter from start to finish. I've tried to break it down to what we need to know for you to be able to support understanding of the objectives. Okay, so here we talk about transcultural nursing. How do we differentiate between culture, ethnicity, race, religion? And you can read through those 11 objectives. Okay, so here's what we're going to cover. Here's what is covered in this chapter: addiction, anxiety, communication, culture, evidence, family dynamics, professionalism, and safety. Remember, the topic or this chapter is called Cultural and Spiritual Aspects of Patient Care. So there's a lot to consider. Okay, what's transcultural nursing? Transcultural nursing is we are expected to provide culturally competent, culturally appropriate care for whatever culture our clients are. And our society is so diverse right now that you as nurses, and I'm sure you've already experienced it, right? You're going to be caring for a multitude of cultures. And nobody says that you have to be knowledgeable about every single culture, all their values, all your beliefs. How do you become culturally competent? I guess that's a question for you. What have you done in your working life as a nurse or CNA or whatever? What have you done to get yourself culturally competent? Because I know you're taking care of lots of different patients from lots of different cultures. What have you guys done? And what can you do?
You can ask questions.
You have to treat them all the same, I guess.
Well, and how do you find, if you're not aware of their culture, how do you find out about it?
You build a rapport, ask questions.
You have a conversation with the client. You learn about their cultures through conversation. That's what therapeutic communication is about. And I know I've stressed this before, that's about what is the most important thing to establish with a client right off the bat?
Trust.
Trust. Why?
Because if they don't trust you, you won't find out nothing. They won't share, they'll shut you out.
Exactly. Chantel, what else?
That's what I was saying. They will open up to you. They would give you more information concerning them.
Right. Exactly. So that's the most important thing, especially when you're working with different cultures. You have to establish trust. If you want to learn about what their values and beliefs are, which you need to know, because that's going to direct your care, right? Because you're planning their care, their cultural beliefs, values, practices are all part of the plan. Okay. So here we need to understand the difference between religion and spirituality. We call it religiosity and spirituality. So here's the difference. When you're talking about religiosity, okay, you're talking about a specific religion, whatever that is. So you belong to a church that practices this kind of religion. So your congregation is focused on one religion. Okay, you practice one religion. Where spirituality is your big picture view of the way the world works. Okay, so spirituality, they say here in the book, is a deeply subjective experience that tries to explain your thinking process of the whole of physical, non-physical world. So what do you think spiritually about everything? And then the religion hones it into one specific religion. Okay, so what are the rituals? What are the beliefs? Okay. So know the difference between those two words. Okay. And then it goes through some different major religions. I don't need you to know. I would like you to know what the major religions are. As far as reading through all the sections, it's not necessary. Okay, so one of the major religions is Christianity. Okay, one is Islam. Another is Judaism. So I just need you to know what they are. Okay, and then Hinduism, Buddhism, Taoism. Okay, so all these boxes that are underneath these are just going through specific beliefs. You don't need to know that. You just need to know what the most common religions are. Okay, and this is interesting, nothing to memorize or understand here, but look at the religious dietary practices. Really interesting to see things that hopefully either you know about a specific religion or you ask the client. You know, if they're in the hospital and you're helping them fill out menus, probably good to know what are their practices. Okay. And here's a section on developing cultural competence. Okay, so have a look at this section. Okay, page 191. All right, we must develop cultural competence and to be able to competently care for our patients. And for nurses, this is kind of a lifelong process. I mean, I worked in school nursing for 20 years. I learned about different cultures or different groups coming into the schools with the kids, and I had to learn about what the needs were of different cultures, you know, as far as healthcare when they came to the clinic, what could we do, what should we avoid. Okay, so cultural competence, the actual definition is knowing yourself, examining your own values, your attitudes, your beliefs, and your prejudices. Right. It also entails trying to keep an open mind and trying to see the world from different perspectives, different cultural perspectives. Okay. What are some barriers to cultural competence? What do you think some barriers are to cultural competence? What have you seen in your practice, whether it's with you or coworkers? Maybe stereotyping, right? That you assess certain beliefs of a culture without addressing individual needs. You make generalizations, so you're stereotyping. Prejudice, and I want you to know these. I think you're going to get a question about barriers on the exam. So we need to know barriers. Okay, so what are barriers to cultural competence? Stereotyping, prejudice, ethnocentrism. Okay, ethnocentrism is kind of cultural blindness. It's your inability to recognize that there are other cultures that exist. Cultural imposition, which is trying to impose your own values on other people. And then cultural conflict is obviously a misunderstanding or a conflict that you have that creates a situation where you're unable to maybe care for that client. I mean, cultural conflicts are unavoidable. They're going to happen. But you need to try, you have to try and minimize the effects on the patient. Okay. And again, that may be finding somebody else to take that patient assignment, whatever. Okay. And then cultural shock is another barrier. Okay. The feeling of helplessness, discomfort, and disorientation. Right? Where you are just unable to effectively understand a cultural group whose beliefs are so radically different from yours that it prevents you from providing proper care. Okay. Some cultural differences that are common. Okay. Communication. Maybe the view of time. Certain cultures are focused on the past. Certain cultures are focused on the present. Certain cultures are focused on the future. Personal space. Some cultures like very little personal space between people, or hugging or not hugging or keeping your distance. Families and social organizations. Lots of cultures have certain beliefs around family always being present, social organizations belonging to, nutritional practices. Cultures are very different. Cultures have different nutritional practices. And they also have very different views on end-of-life care. So we have to be mindful of those. Okay, and then this whole next section, what I need you to understand is what are some of the common cultural differences you may experience. Communication, view of time, personal space. That's what I need you to know. Okay, the list of these right here. View of time, personal space, family and social organization and structure, nutritional practices, and issues related to death and dying. So there's 5 of them. And then it goes through each one of those. Okay, but I just need you to understand what those 5 are. Okay. Okay, this is a good section to read. Okay, this, I told you at the beginning of the term, we practice ADPI, we practice the nursing process and community nursing, public health nursing. Nursing process is used all across the spectrum in our profession. One of the things that in this class is you have to be able to apply the nursing process into a different setting. I know you're mostly used to applying the nursing process in clinical settings. I get that. But let's think about applying it into the community setting. Okay, so this is an excellent section I want you to read. It's the nursing process and the clinical judgment model in transcultural nursing. What that means is we're moving towards next gen. Next gen, one of the foundations of next gen is using the clinical judgment model. Okay, so this section walks you through the nursing process. This is for transcultural nursing because that's the chapter we're in. It walks you through the ADPI for how do you apply the clinical judgment model in transcultural nursing. So this would be a section I would highly recommend that you read. Okay, it starts on page 198. Okay. Okay. And then since you're responsible for this whole chapter, for the most part, I just highlighted out the areas that I wanted you to really focus in to understand cultural competence. Have a look at I don't usually do this for every chapter because you're only responsible for, you're not really responsible for full chapters. There are a few, and this is one of them. Others, we pull out certain pages, but this is a whole chapter. So have a look at this. Have a look at key points. It's a nice summary. Okay. Let's go back to our notes and see. I think we probably covered most of this. Yeah. Okay. All right. Next, I want to talk about is loss, grief, and end of life care. This is on page. What you're responsible here for is page 206. So I'm just going to put this in here. 206 through 218. Okay. Okay. And this is chapter 15, which is loss, grief, and end of life care. This subject is so important in the community setting because so much of our end of life care is now provided in the home or provided in the community setting. Okay. How do we help clients and families deal with loss? How do we help them deal with grief? All right, so let's go to page 206. We'll start there. Okay, and here's where we are learning about hospice and palliative care. Okay, so remember, 206 to 218, not the whole chapter. All right, what is the goal of palliative care? What is palliative care? I'm asking you
Like
guys.
treating the symptoms of the disease to keep the patient comfortable.
At the end of life. Right. Improve the quality of life of patients and their families while dealing with life-threatening illnesses. Okay, by reducing or relieving the symptoms. Okay, that's your definition of palliative care. I just highlighted it for you right there. Okay, we know that palliative care does not postpone or hasten death. Okay, instead we try and look at it as preserving life. Okay, preserving life while accepting death as an outcome. Okay, palliative care interventions are designed to try and just maintain the client's ability to live as active as possible until death. Okay. You need to know, you need to have a good understanding of box 15 here. Okay, page 207. Okay, what are the rights of a dying patient? So please review this. I'm not going to go through it all, but please review this. Okay. Be treated as a person until death. Okay. Human dignity, empathy, compassion. All right. Try to have the pain under control. Okay. So have a look at this. So the whole hospice philosophy is based on the acceptance of death as a natural part of life, right? And hospice really does emphasize the quality of the remaining life. Okay, we know that patients with an incurable illness suffer in many, many different ways. They suffer physically, they suffer psychologically, they suffer emotionally, spiritually. And the practice of hospice is a multidisciplinary approach. Okay. Physician, nurse, caretakers, family, counselors, right? If you want to look at a care plan, have a look at this, page 209. This is a care plan of a dying patient. Okay, it gives you the scenario up here and your plan down here. So have a look at this care plan. I mean, it outlines what the common care is for the dying patient. Okay, what do you do? I'm looking over here, patient and family. What if you're the hospice nurse? What if you're part of the care team that's caring for an end of life client and you have families that are, I don't know, difficult or don't want to be involved or not really engaged in the process? What do you do? Because obviously that's a goal for end of life care, is you want to have everybody pulled in. Everybody part of the process. What do you do? Hopefully, if you've established trust with that family, you can sit and talk with individual family members. How can you bring them in? What's going on? Is there anything I can help you with? I mean, who knows? Maybe they had somebody else die in their life recently and they're just not able to cope with another person dying. But part of that hospice nurse role is really not just to take care of the client, but take care of the whole family. Okay. And I always like to review this table of 15.1. This is the stages of grief. Stages of coping with death. Kubler-Ross. And I know you've seen this before, right? Please tell me you have. Denial, anger, bargaining, depression, and acceptance. So be able to identify, if you're given a scenario of the dying patient or the family response to the dying patient, be able to identify what stage that client or family member may be in. Okay. So if it's a scenario that asks, why me? The patient saying, why me? That would obviously be in the anger stage, right? So be prepared to understand what each stages mean and what stage a specific scenario may be in. Okay. And again, here's your nursing process applied to hospice and palliative care. All right, this is your clinical judgment model. Really prioritize taking the time to read this section. This is what Next Gen is all about. Still using the nursing process, absolutely, but using it in a clinical judgment model. Okay, so that's on page 210. So please have a look at that. Okay. And then just so you know, when it goes through the different, ADPI assessment, all the boxes between assessment and implementation, which is the next one, they all apply, I'm sorry. So assessment. So under planning, it has a box. These boxes are directed, the information in them is directed towards planning because it's in that section. Okay, same with implementation. So health promotion box here is part of the implementation section, as is the opioid, as is box 15.2. Okay. And then it goes through, we don't need to cover this section of signs of impending death. But here again, legal and ethical aspects of life and death. Do you guys know what an advance directive is? Okay, advance directives outlines the patient's wishes, outlines what their healthcare preferences are. They do it ahead of time because if they become incapacitated and cannot communicate their wishes, this is already in place. Okay. And we ask, I mean, when patients are admitted to the hospital, that's one of the things we always ask. Do you have an advance directive? And then what about euthanasia? How do you feel about euthanasia? What is euthanasia? Ending another person's life to end the suffering, whether it's voluntary with their consent or involuntary without their consent. I mean, another word for euthanasia is mercy killing. Okay, how do you feel about that? So again, things to think about. Adequate pain control. This is what happened with my mother-in-law. Okay, even though part of the process of end of life is pain control, the caregivers just thought they were moving her timeline up quicker. Couldn't do it. All right, nurses must advocate for compassionate end of care. Okay, knowledgeable and skillful symptom management. Okay, the relief of suffering, the relief of pain. Okay, and then comes the issue of organ and tissue donation. Another thing to consider. How do you feel about that? Okay, it's usually the primary care doc that the conversation has been had ahead of time. If it hasn't, then family members make those decisions. Okay. And I'm not going to ask you to review all of this key points because we only covered a few. We only covered part of the chapter. So I don't want to confuse you and overload you with reading all. You could read through it and pull out what we've covered with regards to hospice and palliative care. But remember, you didn't have this whole chapter. Okay. So let's go to, there was one thing I wanted to cover. I think it was in the, hang on. It was in our module. There was a teaching sheet in our module. You know, when it said, it gives you the readings, right? And if it says right here, week 5 reading, that's your readings we just went through. But if it says, if there's an additional reading sheet, it comes right from your module. Okay, has anybody had the chance to review these? Okay, that's part of your review this week. All right, this is right in your Canvas. Okay, right in your week 5 module. Okay. Okay, let's see. We just talked about hospice, palliative, just going through the notes that you were given for the week. We went through that. We went through hospice. Physical support, social support, spiritual support. We started talking about the stages of grief, Kubler-Ross. Here's a more detailed explanation of it. Therapeutic communication falls into this week's teaching with all these topics of grief and death and end of life and ethics, right? Therapeutic communication, trust. We have to develop trust. Okay. Asking open-ended questions, pain control, oxygen and suctioning. This is end of life. Okay. Faith community nurse. Okay. What does a faith community nurse do? So has anybody ever heard of a faith community nurse? I bet a lot of you guys don't know that whatever religion you practice, wherever you practice, whether it's a mosque or a church or a temple, whatever. I bet a lot of you don't know that your congregation, whatever it is, probably has a faith community nurse. Okay, a faith community nurse is part of that part of the team in the congregation that could do many different things. Okay, very focused on education. They may do home visits to new families. They may do grief support groups. They may do health fairs. They may do counseling. Okay, the difference between a faith community nurse and a nurse is that the faith community nurse brings in the spiritual, whatever that may be, brings in the spiritual, holistic aspect of care. Okay. So it's more than just community oriented. Remember that community oriented nurse is focused on the community at hand, where a faith-based nurse has her congregation as her community, but adds a spiritual piece into it. Okay. And here's where we talked about the difference between religiosity and spirituality. Okay. And here's a nice summary of both of them. Okay. And in this section in your notes, we give some examples of primary, secondary, and tertiary. So a primary prevention would be maybe weekly walking groups or education for healthy diet, providing education regarding immunizations to new families. That's all preventing something before it happens. Secondary, screening, blood pressure screening, glucose screenings. A lot of faith community nurses in their congregation do health fairs. Pregnancy testing, HIV testing, screening tools. And then tertiary, your clients already have a condition, disease, right? So you're working with patients or clients with diabetes, maybe obesity, anxiety, maybe doing training with blood sugar monitoring. Okay. You have a family that is in hospice. Okay. They have that diagnosis, they're end of life. So you're helping them treat, helping them manage that. So that's a tertiary. Okay. So we've covered all the notes there. So we've covered everything in the book. We've covered all the notes. I need you guys to turn your cameras on, please. We have covered all the 4 topics: hospice and palliative care, death and dying, faith and spirituality, and ethics. Does anybody have any questions? Nobody? And these are tough topics. They are. But you're going to be working with these clients. Okay, it's not all end of life. You're going to be working with clients that have had some kind of a loss. They're going to be going through the grief. Okay, you will be working with dying patients, or you may be part of the team that's working with dying patients. So much, like I said at the very beginning class, so much of this care is now being provided in the community or at home, where much of it used to be in the hospital setting. Okay. All right, let's take our quiz. Professor Kershaw warned me that there were a couple of quiz answers that were wrong, that we as instructors need to change. So I'm sure we'll stumble upon those. All right, so everybody pull up their quiz 3. Oh, I know what I need you guys to do after we do our quiz. Remind me to have you guys do your survey. Somebody please remind me. Okay. All right, let's get to week 5, quiz 3. Everybody pull up your quiz. Everybody got it? Okay, school nurses engaging in a primary prevention program. What's primary?
Prevention.
Okay,
I would say B.
okay.
D.
Okay, well, if we're creating a pamphlet describing appropriate prenatal diet, then that means they're already pregnant.
Okay. Also C, educate. I don't know.
That's-
No, because they already got
No,
that one.
they
say
already have,
B.
no, they already have.
Because learning how
B.
to obtain ongoing contraceptives. I would say that.
Yeah,
Okay.
it had to be B. I
I'm gonna
agree.
say B.
What do you guys think?
B.
Okay,
I kind of think A or B.
I'm thinking B. Is B correct?
Yeah, I think so.
Okay, well, click on B. Do you guys get the incorrect correct right away, or do you have to wait till the end?
Wait till
Gotta
the
wait
end.
to the end.
Okay, let's see how well we have to see what few questions Dr. Kershaw pulled up. Okay, number 2. Which counseling is appropriate to provide a pregnant adolescent? Well, we know it's not
First one.
C or D.
I think
Right?
A.
A.
Okay, I think it's A too. I don't even have the answers. But I think A is correct. Question 3. Which intervention should be prioritized for a child who has witnessed a violent crime?
C.
Yeah, C.
Anybody else have a different answer?
I think that
C or D.
in the meantime, like until they get the referral, they could teach them stress reduction techniques, which could be priority because they need something right now, whereas to the referral would, take
Well,
some time.
the event's already happened. Right? So
Say
now
D or C.
C, I'm thinking C.
Okay.
Right? Because observe for emotional and behavioral development, maybe we observe first and then obtain a referral if we need it. D, I'm thinking D, where we don't know if they're going to have how they're going to be impacted. Why do we automatically jump to obtaining a referral?
But is observation really an intervention?
Yes,
Yes.
Oh, okay.
because think we observe or monitor vital signs, so that's the same thing as observing, I would think.
I'm going to go with D. And if we come on some questions that the answers are incorrect, I'll sort that out when I'm doing the grading. Okay, it's more important for us to understand what the answers are and why the other ones are not. Okay, which is a secondary prevention for mental health? What is secondary?
Say
Screening.
A.
Screening.
I would say B.
I thought, I said
It's
A.
screening.
Screening.
Whoever said B, that is primary, right? We're teaching stress reduction. We're teaching that before any issues happen. Okay, A is the correct answer. So we know that B is primary. What's C?
Tertiary.
Why is it tertiary?
Because they can be in a facility.
Keep
They
going.
already on antidepressant medication.
So, which means they already have probable
Already been
diagnosis of
diagnosed.
depression.
Right.
And so we're trying to help them manage their depression. And if they're on medication, one of the ways we help them manage is observing for side effects. What's D?
The events already happened. They already have PTSD. And so D probably is tertiary as well.
Does everybody agree with Kindle, or does anybody have any additional input? Exactly right. They've already been diagnosed with PTSD, so we're helping them manage that. Which nursing assessment is most important in clients abusing oxycodone?
Apnea.
Okay, did you guys learn that in Med Surg?
Yep.
Everybody in agreement with that? Remember, and I should mention this again, that this class is offered at the end of your program because we're bringing everything together. Right? We've talked about that, right? That you're bringing your Med Surg tools, your PEDS tools, your geriatric tools, all of your, everything you've learned, concepts, topics, is all coming together in community. Okay? Okay, number 6. Which reflects tertiary prevention in substance abuse?
C.
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 A. No, I mean B.
Okay, what's A?
It's B. Tertiary. I mean that's secondary.
Okay, why is A secondary?
Because it's screening.
Thank you. B.
It's B. That's primary.
That's primary.
Yeah, why is B primary?
Because they're providing
It's
with info
prevention.
regarding.
Exactly. Why is C the right answer?
They already have. They're already in
Right.
LD.
Yep.
And we're helping them manage.
And what's D?
We're helping them manage as well.
So D is secondary. Why is D secondary? Okay, we're screening, right? We are helping parents develop adaptive coping mechanisms so that they can early identify if we're
So
talking
would
about
that be
kids here.
prevention?
Well, it's kind of right in the middle,
Okay.
right? If it had said helping parents role model adaptive coping mechanisms, that tells me there's already an issue. Okay, maybe their kids have been identified as having issues. So they've screened that family as maybe an at-risk family. So they're trying to help the parents learn coping mechanisms so they can pass that on to their kids. That's how I think of it. Is that fair? Okay, number 7. Which nursing intervention reflects non-malfeasance? What's non-malfeasance? Beneficence is do good. So what's non-malfeasance?
It's harm.
Do no harm. So what's the right answer?
B.
B.
A.
Well, actually, B is kind of the opposite. You're
Opposite A.
Yeah, because you're getting rid of the body's normal processes by inserting a feeding tube on someone who doesn't need
right.
it.
So
They
you're
swallow
actually
normally.
doing harm. You're doing
Right.
harm. B, you're doing harm.
It's
Right?
A.
It's A, I think.
Okay.
Because you contaminated the sterile field. In order to do no harm or cause infection to a patient, we get a new one. We start over.
Yep.
Right.
Why is C the wrong answer?
Because if you don't document, it's not done, but so no one
Correct.
would know.
Why is D incorrect?
Because you're not helping the patient by not telling them that a nurse is under the influence. You're just
Right.
harming the patient.
You're not helping anybody.
Mhm.
You're putting a lot of people at risk if you're not communicating concerns about a coworker. Right? You're putting
Mhm.
lots of people at risk. So A is the obvious correct answer. You guys understand that?
Mhm.
Do no harm. Okay. Hospice nurse notes that the client's pain is poorly controlled despite a fentanyl patch and as needed sublingual morphine. Which intervention is appropriate?
I think B.
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 Okay. Why is A incorrect?
Because they're already dying.
We're not worried about risk of addiction at this point, right?
Right. Mhm.
Why is C incorrect? Why would we even plant that with the family?
Right. That's just.
Why would, I mean, our goal is to have a pain-free
Mhm.
death. All right, we can't, that's not correct.
Mhm.
That's not a hospice practice. We do expect that the death should be pain-free. And why is the last one incorrect?
Because you don't do that. You don't put a patch where you put the last one. You remove it, clean it, and apply it elsewhere.
Mhm.
You rotate.
Okay. So why is B correct?
The healthcare provider is going to have to be notified because they need extra.
Right. Right. If our goal is pain control, and by whatever signs we are observing, the client isn't comfortable, yes, we would be notifying the healthcare provider, hey, this isn't working, what else can we do? Okay. Number 9, client tells the hospice nurse, I do not understand why God is punishing me. What's your response?
What makes you think you're being punished? Open-ended question to encourage more conversation.
A to me would be insulting.
Yeah. Sorry.
Right?
I should mute.
I don't know, B, that assumes their religion, that they have a pastor. Right? I think C is just patronizing. Right?
Yeah, it doesn't help
Like
you more.
accept it. Yeah. Right. But letting them talk about it, just like Kendall said, open-ended questions. Most of what we do in hospice and palliative care is listen. Right?
Yeah.
Question 10, last one. A client with metastatic cancer has made the decision to stop all cancer therapies. Which statement by the nurse reflects a respect for the client's autonomy?
A.
Yeah.
Okay, why is B wrong?
Because they already stated they don't want it.
They've already made their decision. Right?
Mhm.
Yeah. Okay, C makes it seem like you're questioning their decision. You're being
Right.
judgmental. Right?
Mhm.
And then D is inappropriate.
Mhm.
If they've already made their decision, right? So yes, you're offering, what can I do to help, basically? What can I do to help? All right, so submit your quiz and let's see how we do. Let's see what couple of questions Professor Kershaw was referring to that we all got wrong. Because I'm doing this right alongside you.
We made an 8 out of 10.
3.
Yeah.
Okay, so what's the question? What are the questions that were wrong?
Three,
It
three,
was C.
the referral.
3 was C.
Yes.
Yes.
Let me go back. 3 was. Oh, okay.
And then on number 9, we were
On number
supposed to
9.
assume they had a religion about the pastor.
Call the pastor.
I remember that from last term. So number 9 is B.
B. Right.
You guys can't change your answers, right?
No.
No.
Okay, I'll go ahead and change them. Okay. Okay, and those are the 2 questions she must have been talking about, so we'll have to revamp those. But do you have a pastor I can call for you? Well, I don't know if, okay, I guess I could see that. Number 3, I guess number 3, you're making the assumption that they're having issues. So that question maybe needs to say, which intervention should be prioritized for a child who has witnessed a violent crime and having issues, having behavioral issues or something, right? So I think we have to identify in that question that there's actual reason to seek a referral, not just that they witnessed it. That's my feedback. So just submit your 8s and I'll take care of correcting 3 and 9 for you guys. How's that? All right, let's jump to our attestation. Week 5, everybody go to week 5 attestation. There should be 2 questions. We're just knocking these out today, okay? Let's see what our questions are. Oh, do you not have any questions this week? Do you guys have questions? Oh, preview.
Yes, ma'am, we do.
Yeah, you do. Yep, I have to hit preview. Okay. So unfortunately, we have to do all of them. Questions 1 and 4 are the same. Okay, it would just be whatever, what's today's date? The 3rd or the 4th? 4th. So just do 1 and 4 first. 11 for Marvel. So just do 1 and 4 together. Okay, number 2, what's the goal of hospice and palliative care? What have we learned today?
Improve the quality of life of patients
End
and
of
their
life.
families.
Alleviate suffering.
Yep. Comfort care. Yep. Dignity. Family involvement. Does anybody work with clients in hospice or palliative care?
I do.
Do you really?
Yeah, I actually enjoyed it too. Hospice in Cincinnati here in the city. I worked out in the field.
Wow.
Yeah, but some of them you didn't even know was even on hospice, and that's when they told me that they can be on hospice for 6 months.
Oh, sure.
And then they have to take them off of it if you know.
Okay, last question. What is an ethical dilemma? I'm going back to our notes here. There's a good definition of an ethical dilemma.
A decision with 2 morally justified courses of action.
Yep. Do you hear that?
That's the one when you talked about when the prisoner was like the CO family member was killed by the prisoner and she worked with him. I think that's the example you gave us then.
Yep. Ethical dilemmas are
problem or conflict may result when people have different values.
right. Right. When your values and beliefs conflict with your client's beliefs and values. You'll face ethical dilemmas all throughout your nursing career. And there's no right answer and wrong answer. That's something that you need to process internally, right? We deal with ethical dilemmas outside of our nursing, with our families, with our friends, with our coworkers, right?
Nada.
Ethical dilemmas are a part of life. Okay. Okay, my friends. Happy Friday. Have a wonderful weekend. Does anybody have any questions? Did you learn a lot today?
We did. I have a question.
Yeah.
Have you figured out how you're going to get rid of your dog problem?
I haven't heard the dog bark. Obviously, my text worked.
Probably resolved then.
Until he comes out again and barks. I might just go buy a... No, that's probably cruel. I would never put a bark collar on my dog. Never. She responded with, oh, next time I put them out, I'll put their bark collars on. How about just train him not to bark all day? I don't know. I'm surrounded by people who have dogs on all sides. These are the only dogs that bark. Anyway, well, it's good to see all you guys today. Happy Friday. I'll stay on if anybody has any questions. Just reach out. Oh, no. There's one other thing I need you to do. I'm sorry. I need everybody. Oh, I'm losing people, but I need everybody to go to their account section. You can do this when we get off. I would like for everybody to go to their account section if you don't mind. And if you it's a pull down menu, and in your account section, it has evaluations. This is the week we do midterm evaluations. So I would love to hear how you feel like things are going so far. If you have any suggestions for me, any suggestions for the curriculum, just any suggestions at all. Okay, I love feedback for both me and for the class. So I'm not going to hold you on to do it like I've done my other classes. You guys lucked out. I did that at the beginning of my classes. So if you would do that, that would be great. Otherwise, I don't have anything else. Okay, so reach out if you need anything. Good to see everybody.
Have a great weekend.
Okay, thanks, Kendall. You too.